I don't want to appear on your broadcast.
No. Well, I'm going to get killed, so.
Okay. Oh, yeah, well, there you go.
So please, go ahead.
Yeah, fair enough.
So you were saying that neither, or he said that he wants you to believe that there were no complaints from the nursing.
What was breathtaking was that the governor asserts that he didn't know the detail of the health department order, that nursing homes themselves could decline readmission, and that he hadn't heard from any nursing homes complaining about the rigidity of that order. None of that can be true. Either he was totally divorced from the day-to-day operations of state government, or he's lying. I suggest he's lying. Keep in mind, at the time, the state legislature this was unique in the country. The state legislature granted the governor of New York the capacity to create law. They ceded their authority to the governor of New York, and he could write, by executive order, new law. So that order was seen as law by nursing homes. Those nursing homes complained. He organized control rooms, meetings among public officials in each region of the state. At every one of those meetings, I communicated personally the concern that nursing homes had. That process would have reported up to the governor's office. Either these were fundamentally window dressing, which of course they were to a degree, or again, he's lying. I suggest he's lying.
Did he say who wrote this order?
Oh.
Because that's never been very clear. Was it somebody in his executive office?
He asserts he didn't write it and that Dr. Zucker didn't write it. Now, I think that, knowing the governor as I do, what he's suggesting is he didn't actually type it. But there is little question that the Commissioner of Health and the Governor of New York knew the order. They want to assert that that order is exactly the same as the federal CMS order, which it is not. The state order says you shall take back individuals, and you cannot deny them solely on the basis of COVID, which left them no option but to accept individuals that we knew would cause risk to the other patients.
So he's now saying, so do I have to?
I don't know if it's now saying. I haven't heard his regurgitation of this nonsense for quite a while.
From what I understand,
Yeah.
what you just said is that he's saying that nursing homes could have said no
Yes.
to these COVID patients. Then why does he keep saying, I guess, that that this was all coming from the federal government, that this was all federal guidance, and they were just doing whatever the federal
Andrew Cuomo is attempting to shift blame for what was a clear directive. The clear directive was from the governor, who was allowed to create law and exercise extreme executive authority, unlike any governor in the country. He wants to shift the blame to the federal government. The governor maintained at the time that nursing homes could not say no, that the order was very clear, and that and then subsequently, when they identified and knew that the order was causing great loss, they subsequently cooked the books to suggest that the numbers of those who died in nursing homes were much less than we knew was accurate.
Just really
Yeah, go ahead.
Your experience with this order as
Yeah.
the county.
Yeah. So Dutchess County did not have a public infirmary or nursing home, so we never had to push back. But there are, of course, County Executive McLaughlin is most known for it, and rightfully so. Every day, my public health department interacted with nursing homes and hospitals, and the tension and conflict that existed because of this order was absolutely clear. Hospitals were being pushed to get individuals with COVID back into nursing homes, and nursing homes were frightened to say no. Why? Because the state of New York regulates them, and they were certain that the state of New York would rescind funding and would use regulatory authority to make their lives difficult. Again, from a governor who, unlike all the other 49, was given the capacity by the state legislature to simply write law and enforce it at the drop of a hat.
Have they started talking about the undercounting of those deaths and whether that had anything to do with this $5 million book? Have they gone there yet?
They're getting to that.
Okay.
But I do, what the governor asserts is that, and he said this publicly, so we can say, he does not think it matters that they counted 6,400 and the real number was 9,000, because these individuals died somewhere, says he. The difference is the reason that this governor's administration and the governor wanted nursing home deaths to be lower was because of the direct connection to his order. He suggests there's no reason. There's one fundamental reason: the politics of that order affecting the reality of lost life. He asserts there's no difference. That is absurd. It is insulting, and it is ridiculous. I was truly stunned to hear it.
Can you elaborate a little bit on what you said about him not knowing the order existed?
He asserts that he didn't know the order existed until sometime thereafter. He asserts that the order was the same as the federal order, which it was not, and he asserts that the order didn't override state law, which of course is absurd because the state legislature gave him the capacity to write law, and he asserted it through Article 2B of New York State Executive Law. He was given the capacity to close nursing homes if they said no.
And you mentioned those regional control meetings. When had those started?
Oh dear God, it was before the orders. We were either having county leader meetings with state officials or then the regional control rooms just before the order. Because, again, we divided up the state. It made sense to a degree. Public leaders would communicate on testing, on vaccination, on response, on priorities, on concerns, and on questions. And each region had a state administration designee. On our calls, it was mostly Larry Schwartz, which was thrilling, I can assure you, for those of you who don't know Larry Schwartz. But these calls were meant then to report up to some apparatus in the governor's operation to then respond to concerns. There is zero chance that the governor of the state of New York did not hear the concerns that we heard every day, but from both by hospitals who were being pushed to get patients out and nursing homes who were being forced to accept COVID-positive patients in. And if that didn't report back to the governor, then there was no reason for the governor.
So just putting a button on this, just so we're all clear.
Yeah.
He's saying what you heard of him saying. He's saying that he didn't understand the order, or he didn't know.
He didn't know of the order. And the governor asserts he did not know of the order until after it was issued, and asserts that the order is exactly the same as the federal guidance, which it is not.
Thank you very much.
But he knew about it before he rescinded it, I assume?
One would expect that, but of course, yes, because he rescinds it by executive order.
What's the temperature in there?
You mean the interaction, the actual temperature?
I mean, now that I think about it, yeah.
Yeah, we were joking that he probably negotiated a very cold temperature. He likes it chilly. I would say at the moment it's tense, and rightfully so. And 64 degrees.
Well, I was just saying earlier, he was defensive. Is that still, or is he on the offensive?
Well, I will admit, and I give Congresswoman Stefanik a great deal of credit, he was both on defense and offense because of the line of questioning. And rightfully so.
Is everyone taking a turn at this point, or is it mainly
It's lawmakers and staff, and yeah, lawmakers and staff. Okay, thanks. I got to run out and be back.